Ladies and gentlemen, welcome to this week's episode of What the Health Just Happened, where we talk about all things healthcare, community, business, and life. The goods, the bads, the ups, the downs, the lefts, the rights, and everything in between. We are so fortunate to have on a variety of guests way smarter than we are, Trey, and today is no different, sharing their industry and life expertise. This is a mouthful. I love the intros, butchering it. I can get his name right. Wes Marsh. We've built a friendship. We'll get to that. But, oh my gosh, I got to read this. Serves as executive in residence in the University of Florida's Department of Health Services Research Management and Policy. That's a mouthful. Ooh. That's one thing. Contributes nationally to the American Association of Neurological Surgeons Practice Management Committee. Whew, that's a mouthful. He serves as an ACHE regent for Northern and Western Florida, mouthful, and most of all, most important, recently joined the board of directors for the Jax Chamber Health Council. We've got him laughing already. We met through the Jax Chamber Health Council. We'll get lots of shout outs to him. But Wes, welcome to What the Health Just Happened. We met a couple months ago. I think we're hitting it off.
I think so too.
And again, your experience in healthcare, you sent me your CV, your resume, your story. I had no idea. Like you're a man of many talents.
I've been blessed to do a few things.
A lot of cool stuff. And I don't even know where to start. There's the Air Force career. There's the political career in Arizona. I think the goal today, personally, talk a lot about ACHE, which you're very active with. There's a specific event we'll get to. So let's start there. How did you end up going into healthcare? And what is the ACHE as a whole?
Well, my career in healthcare started as a medical records clerk in the Air Force, but prior to that, I was a military policeman in the Air Force. And once I started in healthcare, it just continued on. Fast forward, I got a direct commission in the Air Force as a medical service corps officer and did a few things with that. And then that led into some other opportunities as a line officer, non-healthcare related, but taking my healthcare background and experience and replicated that in some other areas where it helped.
Again, there's so much to unpack because we could talk for 48 minutes about the Air Force. I'm curious, did you go overseas? Of course you did. Let's talk about Arizona. You ended up in Florida, you said 2009. Mm-hmm. You're getting your doctorate at UNF. Mm-hmm. Swoop. Love shout outs to that program. I really want to dive. ACHE, what does it stand for? Because I wasn't even really familiar with the organization till last year.
You should join.
UNF.
We have lots of nurses.
Well, again, that's too fancy for me. Maybe one day. But explain what ACHE and why people should join it. Sell me ACHE right now and I'll join it.
Well, first of all, it's called the American College of Healthcare Executives. It's, in order to be eligible to join, you have to be in at least a bachelor's program in healthcare administration or something healthcare related, or have at least a bachelor's degree to be a member. It is the only body that creates or tests board certification in healthcare management. Like in medicine, you will have a neurosurgeon who's board certified in spine and neurosurgery. After he takes a grueling exam and a practical exam. We have something similar, which makes us board certified in healthcare management. And I've always said, we don't hire non-board certified physicians. Why would we not hire board certified administrators to support those physicians? Makes sense. It makes, continuity of care, keeps the hospitals out of trouble, or actually any healthcare organization. It doesn't have to be just a hospital. It could be a skilled nursing facility. It could be an HMO. It could be Florida Blue. It could be anybody involved in healthcare.
So let's use me as an example. I have a nursing degree, and I don't could I apply for the ACHE? Trey has a background in business management, but he works in healthcare. Could he apply for ACHE?
Oh. You qualify as members.
There's a chance.
Now, if you want to,
there's a chance.
No, if you want to be a fellow, which is what the FACHE is, signifies you're board certified.
Fancy ACHE.
But it does a couple things. If you see someone with FACHE on it, it means they've taken a grueling 230 exam, passed it. They have a master's degree or higher.
Okay, now we're talking.
And they have at least 5 years of executive management experience, healthcare management experience.
If nothing else in this conversation, you finally cleared that up for me. Because every time we have a guest on that's FACHE or ACHE, I'm like, what is the difference? A grueling test, right? Like I couldn't go take it right now. I'd have to study for hours.
You got to submit it. You got to be eligible. There's a few things. the main thing is you've got to have at least 5 years of experience managing people or money in healthcare.
So all of you ACHE people with the F in the front, they earned it. It's not like you just go online, fill out some paperwork. Like technically I can do weddings because I went online and filled out some paperwork. It's not the same as that.
No, there's a 6-hour exam that goes in with it covering
I'm not doing
10
it.
components.
So let's say you could pass the exam. You did 5 years in that industry, but you didn't do a good job for those 5 years. Why are you qualified?
Well, in order to sit for that exam, you have to submit an application.
Okay.
Well, part of that will be a review, and there's some continuing ed. So maybe it was 20 years ago that you did all this.
Okay.
Where you're going to be within the last 3 years, you're going to have some continuing education, which is like our qualifying education, things that ACHE certifies that you just sit and go online and try to do.
Okay.
Which the college does offer in-person and online, but that's what really separates us from everyone else. I mean, there's other associations in healthcare, and they do provide a good service, but none of them provide board certification.
So I'm looking at, is it a resume builder? You have this on your resume, right? MBA, there's so many acronyms, FPEM/HC, CHEP, NHDP. Every time I see FACHE, it resonates different now. And I've understood, but what is that? Does that help you when you're going to apply for an executive position at a hospital? Is it get you in the door for other meetings that maybe you wouldn't have got otherwise?
A little bit of both. I mean, it means I'm board certified, just like if I was a physician. My wife's a board certified gastroenterologist. But it does open, because like I said, when you see FACHE, you know 3 things about me without even looking at anything else. You just don't know where.
Incredibly handsome.
Well,
oh, sorry.
Yeah.
I tried.
Very intelligent.
Sorry. What are the 3 things? Sorry, we love throwing you off.
Oh, it's okay. Master's degree or higher, 5 years of executive management experience, and you've passed that 236-hour exam.
Man, see, that's why I love doing this show. I learned something every single time.
So everybody felt like Dr. Mayo.
Yep.
He is a FACHE. Matsuno, who is the new president and CEO of Baptist, he is a fellow.
How many around the country have that title or have earned that?
We have over 51,000 members internationally.
Okay.
I would say a much smaller percentage. I'd have to get the exact number, but it's probably 10%. I mean, it's not a whole lot, because you have to think about it. It's very hard to get 5 years of experience.
Yep.
Oh, yeah.
Right? Even if you get an MHA or an MBA, you just don't automatically. I mean, my first job after getting my MBA from Embry-Riddle Aeronautical University was a secretary.
That's a good name drop right there.
Yeah.
That's a good name drop right there.
And, so not everybody can do that. And so, because you have to qualify, you just can't say, I want to be a fellow. You have to meet the qualifications.
Again, I have to look back, because we've had guests that had that on and briefly went through it. I don't know if I can't remember if Paul Sapia is or
Paul. He's in the process.
Dr. Thompson.
He's eligible, and he's going to be
been on a
tested.
couple of times. But it's just a different approach, obviously. And the ACHE thing, I understand now, which is funny. That has to do with the Health Council. Since you've come on, I think bigger stuff. And again, shout out to the Jacks Chamber Health Council, but getting the ACHE involved, the level of keynote speakers, right? We'll get to this event in a second, but who do ACHE members have access to? What kind of people are in this network?
Anyone across the spectrum that's involved in healthcare. Obviously, if you are an industry partner, Medtronic, Stryker,
Some big name companies.
Yes.
Yep.
I mean, obviously, you could be a fellow, but you've got to meet the same qualifications, right? But you can be a member because you meet that minimum criteria of having at least a bachelor's degree. And then, if you're obviously selling a product, or if you're a clinician, we are increasing more clinicians, because right now, the Great Resignation, more physicians and nurses are actually taking a break and going into administration.
Or sales.
Yep. Okay. And think about it.
Or employee benefits.
Employee benefits.
I'm kidding.
Or academics.
Yep.
But the thing is, what you learn so well, and nurses, I treasure them, because I learned how the importance of nurses when I was in the Air Force, and how important they are to the continuity of care. is you don't know anything about, you're not taught anything about HR. You just know, I know how to take care of patients. That's it. I know, what to do, how to suture to a degree, and different things.
You have the right medication, understand contraindications. How
to do, you get some from, but when it comes to what to ask, what not to ask on an interview, what to do, the federal labor, FSLA, Fair Labor Standards Act.
That was a mouthful. Let's try to say that again.
Yeah.
So what is it? The federal,
the federal.
Yes.
Now we got
You'll get it.
FSLA.
Yeah.
Federal Labor Standards Act.
So many
Basically,
acronyms.
that covers the federal government rules that cover labor.
Okay.
Keep going. Well, I'm just taking the selfie while you're talking about it. Keep going.
But anyway, so by being a fellow and a nurse executive, so yes, you can go. And I'm also, you familiar with ANCC?
Again,
I'm not.
Go ahead.
Aren't you a nurse?
Yeah, but I haven't practiced nursing. It's like, here's my question though. How many more certifications do I need? I call myself an entrepreneur now. I keep my nursing license up, but some of these times, like I love Dr. Periani in the Brooks College
Very
of Health.
Smart, man.
Shout out to him too. Like the whole organization. I don't know what's the point of me going back and getting a master's in healthcare administration? That's me personally. But the same thing with all these certifications.
Why would I want and go through 3 years for a doctorate and, do all this research and everything? I mean, why would I do that at my age? I'm like, but age is just a number.
Agreed.
True. I mean, you want to have lifelong learning. You don't want to stop. That's the thing.
I love that. So back to the acronym. What was the nursing acronym you mentioned?
ANCC. That's the American Nursing's Credentialing Center. So if you have a license, not a state license, but if you're a certified nurse executive, they're like the ACHE for nursing. I was actually the first. It's the National Healthcare Disaster Professional. That was to get more nurses, RNs, involved in emergency management and disaster preparedness. And I was the first person to pass the exam and even though I'm not a nurse.
Yeah. I
just bring that up because that's my one contribution, academically, so forth, that I can
emergency preparedness
with nursing. I'm not going to be a nurse. I didn't go to nursing school, but it's ANCC. Every nurse is familiar with that, I guess, except for the host.
Again, don't judge what I'm aware of and not. My career path has been so bizarre.
Well, I want to be like you because you're so dynamic.
Oh man, no, you don't want to be like me. A lot of skeletons in this closet. But I mean, again, constantly I love continuous education. I really do. I always want to consume information and learn. I think conversations like this, I got a lot of notes already, some new acronyms, but it's, I look at the stage of life too with young kids. It's like, is it worth going back to school and having to write papers and read books?
You can't be stagnant. You got to keep, every day you should learn something new. I've already learned a couple things new today that I didn't know before. Otherwise, you become stale, irrelevant. And if you want to talk about, don't get me started on AI, because what I tell students, I actually tell anybody, start now to learn AI, because if you don't, you're going to be irrelevant.
So again, now I love this.
It's like learning to type.
I'm trying to spend at least an hour a day playing an AI, like actually using it, not just reading about it. Yes, there's YouTube tutorials. I think an hour a day spent there is more valuable than going to a class like a master's in healthcare administration. For me,
how do you learn nursing? Do you go and look at it online, or you actually get in a patient's room and practice?
Amen. Completely agree. When I worked in the fire department, I was on the rescue. You have to do it. Trial by fire, 100%. You have to be touching patients. In nursing school, the best students in nursing school were the medics leaving the fire department because they already had that hands-on skill. And I'll be honest, if you hired me tomorrow to work in the ER...
Are you available?
I mean, what's the hourly rate? I don't know. But it would take me months to relearn that stuff. I could still start an IV with my eyes closed. Let's just throw that out there. I could start an IV anywhere, anytime.
But I'll find a bicycle. To a degree.
And again, you don't. Where do you put that time learning and evolving? Again, I think ACHE is a wonderful organization. It's worth it. I just always question myself: is it worth going back to school? That's our first tangent. This is all.
Never will regret learning. And I realize there's some of my cohorts that they're doing it because they're taking to the next level in their career. It was like a check off. It was the bucket list thing, and that everybody's got a different reason. But the thing is, you want, it's a terminal degree. I do not have, all my academic background's in flying airplanes and building airports, not running hospitals and building health
You
systems.
got a crazy story. I love it.
But I do have an associate's degree from the Community College of the Air Force in healthcare management. But this will give me a terminal degree in healthcare administration, which will actually help round out my experience in addition to what I'm doing in academia as an executive and resident, which was really the last piece of my career and my background that to help round out, make me a little more well-rounded person.
Let's pause the education because I do want to go back to what you're teaching, what the students are like, what the doctor program is, but I really want to hammer this event in. So ACHE, which by the way, we didn't acknowledge this. You're a regent. Mm-hmm. And I didn't know what that meant. So I used old Google or ChatGPT. Yeah. You're voted on by your peers.
Yes.
So how many regents are there in this district?
There's only, in our district, if the ACHE has 6 districts. We're in District 2, which basically it's Puerto Rico, Florida, up to like Delaware, and then West Virginia, East Coast. Yeah. And then District 1 is north of that all the way up to...
I looked all this up yesterday, by the way.
All the way up to Canada. So Canada's part of it.
Oh, wow.
So Canada's in District 1, and then you have 3, which is like the Midwest. 4 is like the Texas area. Alabama goes to far is the Alabama. And then 5 is more like the West. You'll have New Mexico, Arizona, California. 6 is the VA, Veterans Administration, and all your armed services. So there's the Army, Navy, and Air Force.
Huh. So, but the regent thing, I'm just trying to
like for me in Florida, we have 4 chapters: North Florida, which we're in, West Florida, which is the Tampa area, Central Florida, Orlando, and then South Florida, Miami. I have the north and western portion, and my colleague. Harula has Central and South Florida.
Yeah, what's her name?
Harula. I can't pronounce her last name. Harula. I'll look.
That's all right. Don't worry about it. We'll figure it out at the commercial break. So, but I'm trying to paint. You were voted on by your peers. Are there multiple people nominated, or that's an honor? I would guess
you self-nominate, and then you're put up for election. And I do know something about running elections. Now, you're not allowed to campaign, which. Running an election, there's really 3 things you need. You need money, you need votes, or you need resources. Since there's no campaign allowed, it's really name ID. And I was chapter president. I actually was doing events in Tampa.
Okay.
Jacksonville, in Tampa, working with the National Association of Health Service Executives, NASHE.
Is another acronym.
Well,
I
don't want to say the abbreviation because it can come across as not a very nice term. So I try.
Okay.
NASI.
That's close to
wow.
Yeah. That's
I was trying to do it in my head for a second. I'm like,
But that is a group, typically a majority of African Americans. They network social. It's a very good group. I'm a member of. I support them. We actually did a joint venture in Tampa. We've done joint events here in Jacksonville. I'm just using an example I'm a hands-on type person. I did that when I was in the legislature. And I've done it as regent. I've been to all of my universities that I'm responsible for seeing.
You're rolling your sleeves up. You're in the trenches.
What they used to say, management by walking around, is we learned in our MBA. I really just like rounding on my patients or rounding on my staff. I round on my members. So that really, they knew who I was. So it was, I don't want to say easy because it wasn't easy, but that's what I did to get elected.
Which, again, just to acknowledge, a regent for ACHE for Northern and Western Florida. This is it's an award like
state.
That's pretty awesome. And I'm trying to throw some clout at you besides calling you handsome.
I appreciate that.
Here's where we're going to nail this event, right? We'll say it multiple times because again, there's some heavy hitters on this. I have not registered, but I will. February 27th from 11:30 to 1:30. We'll get the link in there.
Eastern time.
You are the panelist, right? You're asking questions.
I'm the moderator.
The moderator. Excuse me. Wrong term.
Okay. There we go.
Do you want me to read these names or do you want to say the names?
Please.
So you have Matthew Zuno, is that how I say it? New CEO and president of Baptist. Oh, wow. Again, huge position. Jacksonville. Excuse me. Stephanie Connors, president and CEO of Baycare Health. Never heard of it. Just
Tampa,
kidding.
Florida.
Massive. Michael Holmes, senior vice president in Gainesville, regional president for UF Health. And then you have Ryan Smith, who's also a nurse, president, COO, Tallahassee Memorial Hospital. So
Actually,
you have
Stephanie's also is a nurse as well.
You did tell me
training.
that. Shout out to the nurses out there. Unless you're going back to school, then don't call me. So again, February 27th, 11:30 to 1:30 Eastern Standard Time. Anyone can join this. It's virtual. Is there a cost to it? Correct. Why would you not want to sit in this conversation? One, Wes is moderating, so you've got to sit in on it. But these are 4 heavy hitters. If you can't leave that conversation and not learn something. So what's the agenda? What's the topic of conversation? Why should people join this event?
Well, those 4 leaders, senior leaders, executive leaders, are actually going to share what they're doing in advancements in patient care and how they're dealing with the innovations in health in the current crisis, what they're doing with workforce development and technology, AI, patient care. It really covers a gambit. And the whole purpose of that is, I think, more of a benefit, mostly a benefit for the students, because you know what? The 3 of us in this room are not going to be here forever, right?
Correct.
We're going to be in a skilled nursing facility, and those students are going to be taking care of us.
I love
And you
that
know what
point.
I want to do is I want to make sure I teach them everything I know.
I
and
love
share with other people what they know so they can have every tool, because in university, you learn theory, but you get out, and us practitioners is where we put the theory into practice. I get a little excited.
I love your excitement. You're going to be a reoccurring guest, at least in my opinion. I love these conversations because we had no time to prep. So February 27th, 11:30 to 1:30 Eastern Standard Time for high-level executives. Wes is going to moderate. I didn't even know about it till you sent it to me. There's already, 350 people registered?
Almost 500.
So I would say if you are in the healthcare space in any capacity, student, nurse, executive, I'd recommend joining this if you can. If you can't make it, can you get a recording of it?
We're going to have it recorded, but I would encourage to be live, because everyone's going to have that one burning question: what is it I need to do to go work for Baptist or for Baycare or for UF Health? You know, I'm a nurse. I want to get into a leadership position. I want to be a CNO. What do I need to do? What is it I'm missing? And what skills and what experience to help me be a more successful leader and a better care for my patients. So
we got about 2 minutes to the commercial break, flying by, barely scratched the surface. I've got like 6 pages of stuff that we could talk about. The intro, I'm like, oh my gosh, how am I going to get through this? We definitely got to talk about your most important position as a board member for the Jack's Chamber Health Council.
Yes.
I'm going to poke fun of that. That's how we met. Wonderful experience. I think second half, definitely. Let's talk about education, because you're teaching students. What are students like now? I'm curious. You don't have to answer it now.
Different,
They're
right? Unique.
Obviously, a lot.
Yes, it's just, we have 5 generations in the workforce right now, in case you didn't know that. And one of the things that I instruct or pass on to all of my students, even the ones that come to me for mentoring, is you need to be able to relate with all 5. All 5 do things differently, just like probably the 3 of us in this room do things differently. Some people are all electronic. Some people are not electronic.
Mm-hmm.
You know, I have an electronic business card and I have a paper business card, depending upon who is I'm sharing that with. And that one of the things, and I'm sure you know.
Save this, because we're almost. Let's keep this dialogue a second. I told you I'd bring you in. Wes, I like you more and more, man. We're gonna be buddies. I'm telling you. And Wes Marsh, executive in resident in the University of North Florida. Again, so many other credentials.
University of Florida.
What did I say?
North Florida.
So you were trying to sneak it in there.
Well, you're getting your doctorate from the University of North Florida.
That is true.
Executive in residence at the University of Florida. I will not say go Gators, even though I just said go Gators. That's what the hell just happened. Welcome back to the second half of What the Health Just Happened. If you're here on the radio, missed the first half, good news is you can catch the full episode on your favorite podcast or YouTube under What the Health Just Happened. We have Wes Marsh. I'm not going to read his intro again because goodness gracious, it's a mouthful. Long story short, he's a resident at the University of Florida and a student at the
Executive and resident.
Executive and resident. Come on, man. I can't get all these terms. A regent with the ACHE Northeast and Western Florida. Doctorate program at the University of North Florida. Swoop. We love saying swoop. Again, a lot in the first half, a lot about ACHE. We talked a little bit about education. We got a lot to cram in 24 minutes, starting with healthy or not healthy. You can ask him in return too. Healthy or not healthy being a pilot?
Healthy.
Healthy or not healthy working in politics?
Unhealthy.
Unhealthy? Healthy or not healthy growing up in Tallahassee? I like that one.
Healthy.
We got 2 Tallahassee guys in here. Trey, would you agree?
Oh, yeah.
Healthy or not healthy going to
You
college?
just didn't go to Leon.
Healthy or not healthy going to college in Tallahassee?
Healthy.
Not healthy.
I couldn't have gone there.
I would have partied out.
Yeah.
Well, that was my problem.
Well,
Healthy or not healthy Brooks College of Health?
Healthy.
I would say super healthy. Shout out to them. Healthy or not healthy the UNF Healthcare International Symposium,
Extremely healthy.
which I don't know the dates off the top of my head. I know it's in October.
It's October 21st and 22nd.
Wonderful event. Well, again, I assure you we'll have you back before then with Dr. Periani. We'd love to promote that event. Great event. Healthy or not healthy going back to school at your age?
Age is just a number. Healthy.
That's what I'm talking about. Never stop learning.
Lifelong learning.
I respect that. Healthy or not healthy, ACHE's event, February 27th, 11:30 to 1:30 Eastern Time. Healthy or not healthy?
Extremely healthy.
So one more time, who's on the panel that you're moderating? I got Matthew Zuno. Am I saying that right? The new CEO of Baptist in Jacksonville. Michael Holmes with UF Health. And I didn't write down the other 2 names. Where did I put them?
Ryan Smith. The COO, our Chief Operating Officer.
Tallahassee
Memorial Hospital. And Stephanie Connors, CEO and President of Baycare in Tampa, Florida.
So you have 4 high-level healthcare executives in 4 different markets.
One of them is a fellow, too.
We know what the fellow stands for.
Yeah.
The F in front of the ACHE. It's a
big deal.
We learned that. I know what it takes. I have much more respect for it. So let's dive into the event. I'll be there. I might ask some questions on the chat
Trey
board.
come too?
Trey can do
Well,
whatever
it's
he
virtual,
wants. Man.
so.
Yeah, I could be there.
No, that's it. He'll be at the gym or something. I don't know.
How much
editing
time
videos.
will be dedicated to Q&A?
There's going to be a good bit. And I think some of the questions you will see may be questions that you have yourself.
Okay.
But really, each of those leaders are going to share what they're doing in innovative patient care and the future of healthcare, future of healthcare leadership.
Yeah, it's a great transition. You printed out the questions. These are great. There's no gotcha moments. How do you
can't, it's just like when I was in the legislature, I couldn't stand dealing with media people. They always get the gotcha stuff. I'm like, I'm just trying to do an honest job to represent constituents. And here, each CEO has their own market. They have their own board that they're answerable to.
Yep.
And they're doing incredible things to improve the health of their community.
They're doing more good than bad.
Exactly.
That's what I would say. Because again, if you want to debate policy, I have arguments on what I think the flaws are. Yeah.
The next segment.
This guy, he said his 3 favorite things: policy, discussion, flying, and helping others. That's pretty sweet. Those are 3 good things.
Good ones.
I do kind of want to get into some policy discussion, but we will go off the rails. This event, February 27th, 11:30 to 1:30 Eastern Standard Time. ACHE, you're moderating. Great panel. Workforce strain and leadership accountability, leadership adjustments, accountability and culture. A lot of this goes back to the workforce. I just want to read a random question. When workforce strain becomes chronic, not episodic, what changes in how you lead?
Well, first, you don't let it to get to that point. And being a leader who's present is important, having the trust. I'll go back to a story. I was administrator at Bartram Crossing, Brooks Rehabilitation.
Shout out.
It's a 100-bed licensed facility. During COVID, we all remember how bad that was. At that time, the nursing turnover rate, remember it's a skilled nursing facility. SNF. 2 physicians, medical directors, and the rest was all nursing, right?
How many beds you said?
100 beds.
Okay.
And usually around a 93% occupancy. The nursing rate, turnover rate was around 88%.
That's high.
It's very high, and it's very high for COVID. And I think part of the reason why I was brought in, and I went in there, and after a year, I got it down to less than 40. And I will tell you, and you're a nurse, and a shout out to all the nurses out there, because I love y'all to pieces. You make medicine, you take care of our patients. As I remind my wife, who's a gastroenterologist, says, the doctors are most important. The doctors are important because, if we don't have any APP, advanced practice providers, we have to use a physician. But the physicians are not there at midnight taking care of that patient.
Yep.
The nurses.
Yep.
And that's why throughout my Air Force career, they've been important. But anyway, fast forward. First day on the job, I round on all the staff, all 3 shifts. so you wanted the staff to get to know you.
Were they 8-hour shifts or 12?
8-hour shifts,
Okay.
3 shifts. And I went on the night shift, which is one of the most important.
Graveyard shift.
I mean,
Brutal.
I remember, I went in there and talking to him, asking, how can I help you? What's your biggest issues? What can we fix? What can I fix? Being more proactive, listening. And I could hear somebody in the back say, yeah, he's just like the other administrators. He's just all talk. He's not going to do anything. And then I went in there and I said, why do we have all these thermoses around here? Don't y'all have a coffee pot? And they said, no, we have to bring our coffee in. And I said, oh.
Do you think that was, like, during COVID, they had weird rules? Do you think someone took a coffee pot out because of potential germs?
No, there's a way using proper infection prevention. I mean, obviously, yes, you can, but if as long as you follow those guidelines, the CDC guidelines.
I agree. I think
you
it's,
do that. But
thinking back on how things were handled, it's borderline laughable.
I mean, but and kudos to Brooks Rehab, they exceed expect. That's why they're the number one inpatient rehab hospital in the state of Florida.
Yep.
And doing a great partnership with Mayo, Arizona, building a hospital out there. But they had no coffee. So what I did, I said to myself, that's inexcusable. That's like...
It's such low-hanging fruit.
It's just, and it's low-hanging fruit. And to me, it's like disrespectful. I mean, that's the one thing on the night shift you need.
Also say, don't mess with nurses' coffee, by the way. Nurses and firefighters, give us our coffee. Yeah. And parents.
I bought a coffee pot and coffee and brought it in there and just set it up and walked away. I did not call a press conference. I didn't go and a bunch of, look what I did for you. I just set it there and walked away. And a couple of weeks later, somebody asked, did you do that? I wasn't going to lie. I said, yes. And it meant a lot to him. And the fact that I was very humble, which is important as a leader, to do that. And from then on, that trust was built, because the first thing you do with staff is build trust. Because if you don't have trust, they're not going to be there to support you. They're not support the operation.
I would say that applies to every industry. Healthcare,
every
for
industry,
sure.
yes.
Do you notice a dynamic between the staff in the trenches? So let's say CNAs, nurses. Is there still a rub between administration and the staff in the trenches?
Only if you're not involved. When you're rounding and you're involved, I mean, I probably spent way too much time with my staff, but it paid off because it's important to me. When you really ask them how their family's doing, if they had even if their pet was sick, and that they don't have any kids or a spouse, that's it. That's their family. And it shows you actually have a divine interest in them as a human being. And when they know a leader has that kind of invested, it was easy for me to go say, hey, Ross, can you, Susie called out, can you work a double tonight? You're not, I'm not going to, they would do it.
Yeah.
They won't do that. They did that because they trust it. They know that I'm not going to lead them down the wrong path.
Again, I think this is applicable. You're going to ask 4 leaders in this specific event. That's one question. There's a lot of good questions on here. You talk about, you love discussing the workforce. So you bought a coffee machine. That doesn't create a turnover ratio of 88% down to 40%. What are other things you think in these large systems can be implemented?
What needs to be fixed? Standing up for them, because some people are afraid to stand up for staff because it's going to look bad on me. I'm not going to get promoted. When you do what's right, you don't have to worry about what somebody, you always do, even when someone's not looking, you do the right thing. And there was multiple things, making sure that we didn't accept patients that were beyond our scope, meaning, your care, meaning okay, you're going to have to do round the clock care for this person because of their acuity level during COVID. And that creates additional stresses, and knowing that, our nursing staff, in order not to exhaust them, sometimes we had to, pass on to admitting a patient. This was not a bad, unsafe admission or anything like that. This is done pre-time, right? It's not like there's no emergency room. It's not like they showed up and you have to treat them. You're giving the option.
Man, go ahead, Trey.
I got a question. How much of the turnover could be placed on the patients themselves? Like, let's say you had a patient population that was just difficult. Because 90% of patients are coming in there looking at you guys like, you have the answer, fix my problem. Is there any merit in saying the patients could have to do the turnover?
And there has been somewhat of a rise on patient abuse. And I don't, in any of my facilities or organizations, I don't tolerate any abuse, whether it's between staff, between patients, between customers.
Sure.
I don't tolerate it. And I will give you, to your point, at another organization I was at, they had a patient who was very difficult. And
Physically, emotionally, all the above.
Just disrespectful.
Yeah.
Just
I have these stories I can share when I worked in the industry, but keep going.
yeah, just plain disrespect. It wasn't a lack of patient care.
Sure.
It's just a disrespect for another human being that's actually trying to help you. And they had tried to have him transferred to another facility. They were never successful, and I knew it was important to not just one or two, it was important to a lot, because you remember, when they're in a facility, they're there 24/7. They're not there for just a few hours. It's not an outpatient clinic. And anyway, some things were taken. I took care of some legal things. He didn't do anything wrong. Made sure the paperwork was properly documented and taken and followed up. And we got him transferred.
Gotcha.
Then you think about too, that person goes to another location. When I worked in the ER in the fire department, I have so many stories of physical and like not mentally, verbally abusive. Sure. The ER, which you understand, if there's beds in the hallways and everyone's stressed and anxiety, but there's some patients like you have to be careful when you're walking by them in the hallway, and that's what nurses are dealing with, and physicians, all the staff.
People do not respect people anymore.
I don't know.
Sorry,
I'm right there with you, brother. That's why I brought
it's getting
up
worse.
It is getting worse. We've become, and I know that's for another discussion, we've become more of an entitled nation. And we all have different issues. We all have different backgrounds. Different things happened. None of us.
That's
have
a
the same
good thing,
story.
though. That's good. That's a
diversity.
It's a great country. Yes,
I mean I learned that when I was in Iraq. That when I excluded the Europeans and only used the Americans, things didn't work so well with a NATO mission. So I learned that lesson. But people just don't respect life. They don't respect people. And when you don't,
and again, here we go on another tangent.
Mental health. I mean, there's all the things.
There's so many mental health things. I think COVID made everything worse for a variety of reasons. That's a whole other dialogue, right? But you're talking about people working in a hospital system or a SNF or an ALF, whatever the circumstances, is home health care. They go into that industry because they want to help. It's just like there's bad police officers, but it's a very small percentage. There's bad doctors, very small percentage. There's bad nurses. Mm-hmm. These people go into an industry genuinely wanting to help and provide care, and there's only so much abuse they can take. And that's sometimes, we talk about this like personal accountability. Look in the mirror. I would say some of the flaws are patient related. How do you now measuring that and tracking that?
That's why I wanted to ask. I feel like
that's a great question.
It's exactly. I'm not going to disagree with you. And the issue is that there's other. It's just like solving healthcare, which that's also for another debate. It didn't get broken overnight, and it's not going to get fixed overnight.
Yeah.
And it's the same to your point, to your question. A lot of things have changed. We have more stresses. There's less services, mental health. I mean, all that compounded now.
It's like a perfect
storm. You got a divorce, and you're homeless now, and you're upset with the world, and the world's winning, but you're going to take that aggression out on someone else who's trying to help you, and that's And I know that the Florida Nursing Association and the American Nursing Association, which I'm also a member of.
Which one? What's the next acronym?
Florida and the American Nursing Association.
How many things are you a part of? This is insane.
Well, I care about people and I care about healthcare.
I got a random one for you. So in relationship building amongst like administrative versus like, the foot soldiers, the people on the ground, what is actually your dress attire? Are you walking around when you're mingling with staff like this, or are you in scrubs?
I always wonder why the executives are fully suited out.
Are they?
Well,
all of
not
them.
Always.
A lot.
A lot. But you're. It's like I went as alleged that you're carrying an office, right? He was appointed by his board of directors to run Baptist Health.
Yep.
And he could be meeting, and it dresses professionalism. Obviously, it's just like in the legislature, people would come in wearing T-shirts. I said, this is an institution, and you look like a slob.
I get it. Because I'm not a suit person. I wear them rarely. Sometimes I should, but when I go into a hospital, you immediately respect someone that comes in with scrubs that looks, freshly pressed scrubs, a doctor in a
That's
white
different.
coat.
I mean, if I was a
But the same-
clinician, I'd have my white coat on.
And the same thing, I do actually for a long time, like, why are they all wearing suits? Because it's professional and you should.
Now, there is a business casual, like, the very nice Jack Victor jacket that you have on.
I love this guy.
Uh,
Or dress down Fridays for sports themed
well,
Fridays.
you have a jacket. I mean, that business casual look is appropriate. I just, I grew up, just being respectful and wearing a coat and tie. Now I
wore a jacket for you today. I want you to know that.
I appreciate
I intentionally wore this.
Spice it up.
Let me, because I want to
Are you
talk about.
42 long by chance?
I am not. But everything's short. I can't even, again, there's so many questions here. The event, I think we hit enough. You're in education. You're getting your doctorate. So you're currently taking classes. I'm sure you have to write some 900-page paper at the end.
Oh, and then some.
But you're also teaching. Are you teaching master's level students, bachelor's level students? What?
Both.
So you're teaching
Graduate
both.
and undergraduate.
In specifically public health. Like what topics?
Public health, leadership, healthcare leadership, the healthcare system, policy. And next spring I'll be getting into human resources is one of my favorite subjects.
Human resources in the healthcare setting?
Yes, yes, because it's going to be
how much do they talk about employee benefits and health insurance?
Actually, there is, I think, a whole chapter on benefits in general, pay, benefits.
I think it's a dialogue. We talked about this a little bit. People understanding the cost of healthcare and health insurance, how that impacts your paycheck. But I'll tell you what, I've been in this industry 6 years. Joey was talking about it 17 years. There's a lot of dollars going back and forth. And staff, we had talked about, they'll leave one organization for a 25-cent raise.
It's unbelievable.
When their benefits package is higher. But so back to you teaching, you clearly love doing that. What's your, other than HR, what else do you love teaching about?
Leadership. How to lead an effective organization and really being a change agent, change management, taking poor performing organizations and make them number one.
Creating future leaders. Go ahead, Trey.
So when you're teaching classes currently and you're looking at all these students that are in their 20s, how much faith do you have in this current group versus, let's say, maybe someone that's maybe Eric's age, 43? Do you look at them and go, this is the future leaders, like with question mark, or is it like you're pretty confident in them?
Well, none of us, and I say out in this room outside, came like ready to go.
Sure.
Like leadership
100%.
is something you have to learn. You can't read a book.
Yeah.
But and I would say it's a snapshot of our community, about our society. I mean, you got people who are super smart. You have folks that challenge. I mean, I used to stutter when I was young. So everybody, there's a little bit of everything.
Okay.
But these are
it is the future, whether you want it to be or not.
Yeah,
I'm giving them everything I know because you know what? Somebody helped me. Somebody helped me, gave me that little extra this. I gained that experience that opened up this door, and then I went here and then went here. I mean, there was 2 other officers that were on the list to go to Iraq, and I needed that to get to as part of my career in the Air Force, and it worked out. And I was able to go because the other 2 had to decline because they had other academic obligations in the Air Force that was better for them. Plus, a lot of people don't want to go to combat.
I think I know where you're going with that question, right? So if you look at ages, you talk about there's 5 generations.
I can come back. Go
there's
ahead.
5 generations in the workforce. If I'm looking at students now, when we were there, cell phones were not a thing yet. Like I had a cell phone, but there weren't smartphones attached to their cell phone. I think people going through programs like yours or UNF's master's programs in healthcare administration, those are probably the students that know, like, I want to be an executive at a hospital. They're not like, when I was 18 to 22, I didn't belong in those classes. I'm 43. I still probably don't belong in those classes, but
just
I
the
think,
number.
Hey, again, I know it's not the number. I don't want to read books anymore.
Yeah.
But is that not true? The students that you're seeing are probably
high caliber.
There are. I mean, I have pre-med. I've got future doctors.
Yeah.
And I'm thankful for that opportunity that the University of Florida has provided me to part my knowledge, things that they're not going to read in a book, things that you learn by the School of Hard Knocks.
Yep.
Actually on the streets, taking the theory that you learned at college and applying that and learning Like, how do you deal with someone who just hates the world? And how do you, some just will do anything for
It's
you?
real.
How do you, there's no book. You read a book and, you got to learn because you have to apply it. And then that didn't work. So I'm going to try something different because experience is your best tool. But to your question, limiting electronic access except for what's required, but also if people who are engaged, they're not like, oh, let me, this is more interesting than you.
True.
I'm more interesting than
Yeah.
that cell phone because that text message will still be there, but Wes will not be in that classroom after, we finish. So, and I engage them, and I like to walk around. Obviously, you can tell I like moving my hands. I don't hug the podium.
Yeah, you do. So we got 3 minutes left.
Oh my God!
I told you, it's insane.
God.
This question, you talk about policy. This is a very broad question. I doubt you can come up with a specific answer. But like you said, healthcare policy, changing it, we didn't get to where we are overnight. It's not going to change overnight. But if you could look at one healthcare policy that you could change on a dime, what would you change?
It's hard.
It doesn't necessarily have to be a policy. That's a loaded question.
I will say there's not like, oh, you fix this and this is like,
Yep.
There's, we have multiple things. We have social determinants of health, and we have access issues. We have payment issues. I mean, what we really need to do, if we're serious about solving, we need to get all the players. A word that I like to use is no one wants their ox gored. Is that a bad word?
No.
No, I don't know what that means.
Well, nobody wants to lose their piece of the pie.
Oh, well, yeah, 100%.
You see us 280s, so, huh?
Yeah, we're just like, huh?
So the thing is like, we all want to be successful.
Yeah.
And when you work in silos, as I've recently told some of my students this week, you want to break those silos down and work collaboratively with everyone, because the silos there's a communication issue, but the issue is everyone has a constituency. And this is not disrespectfulness to anyone, because everybody's involved.
Yep.
You've got the payers involved, you've got the hospitals involved, you've got the employers involved, and you have the patient, to a degree, the patients. And since you're dealing with benefits, I mean, how do you determine how much that healthcare policy is going to cost I guess employers, right? That's your customers. Yep. How do you tell that employer how much their health benefits are going to cost them and their staff? How do you determine that? Is it like, here's the set rate? Or does it depend? Do you want no deductible, that you can just go wherever you want to go? You can go to Mayo, you can go to whoever. How do you determine that, right? That's how the employer decides, I want this, and I want to put this limit, or they'll do certain other things. You'll look at their claims history, right? If they've had a whole bunch of cancer claims, you say, oh, we're not going to worry about that, right? Because the payers are going to look at it, because they know how much
taking that risk. Yep.
Now, again, the one thing's not going to fix it all, but I think having everyone in the room to try to talk about it. And I always believe, let's take the low-hanging fruit. Let's start from where we agree. Don't start where we disagree, because all you're going to do is keep disagreeing. And I mean, I can come up with other political things that happen. You've got to start where you agree and then work your way, because when you agree, then you can compromise, because you've got trust.
You have something else? I was going to say, my least favorite part, we ran out of time.
Man, that blew by.
That went way too fast. Yeah, look, I'm going to ask you, did you enjoy yourself?
I loved it.
Would you come back?
I would be honored to be.
Yeah, there's so much. We barely scratched the surface. My goodness. Wes Marsh, executive in residence at University of Florida, also getting his doctorate at the University of North Florida. Swoop. Amongst many other things, including Regent for ACHE for Northern and Western Florida. Wes Marsh, that's what the hell just happened!